Hey there, how's your gut feeling? Everything running smoothly, or are you encountering some bumps in the road? Today, we're diving into the nitty-gritty of colorectal cancer, highlighting 7 red flags you should be aware of. It's not just any cancer, it ranks third in terms of commonality and second in lethality. Shockingly, around 10% of cancer-related deaths are attributed to this sneaky tumor. So stick around because knowledge here might just save a life. Let's split this discussion into 2 digestible portions. First up, we'll dissect the visible and tangible signs of colon cancer, the ones that ring alarm bells. Then, onto the meaty part, prevention. We'll dish out advice on how to slash your risk factors, tweak your lifestyle, and adjust your diet to keep this disease at bay. Oh, and we can't forget about polyps and why colon cancer seems to be creeping up on younger folks under 50. It's going to be a deep dive, so hold onto your seats till the very end. Now let's talk about those 7 telltale signs that your bowel might be trying to tell you something's off. And remember, the last sign is most important, so stick around till the end of the video. Symptom number 7, changes in your bathroom routine. Knowing your regular bowel habits is key. Some folks visit the loo post-breakfast, others are in and out multiple times a day, and then there are those who are more on a weekly schedule. What's yours like? If you notice any deviations, don't brush them off. While bowel changes are common, persistent or worsening changes should raise a flag. Approximately 65% of colon cancer cases involve alterations in bowel habits. These changes can range from shifts in consistency and color to frequency fluctuations. The kicker: diarrhea that persists beyond a few days, followed by bouts of constipation, then back to diarrhea. Any significant change warrants attention. Let's dive into the signs and symptoms that could signal trouble in your gut. Starting off with symptom number 6, blood in the stool. It's crucial not to dismiss what you flush down the toilet without a glance. Understanding the anatomy of your large intestine, ascending, transverse, descending, sigmoid, rectum, and anus sheds light on why bleeding varies. Tumors on the right side often bleed internally, leading to anemia or dark, foul-smelling stools, melena. On the left, bleeding might manifest as bright blood in the toilet or on toilet paper. While hemorrhoids or diet changes could be culprits, don't gamble with your health. Any unexplained bleeding demands investigation. Now on to symptom number 5, abdominal pain. If you're grappling with intense, recurrent cramps or pain during bowel movements, don't ignore the discomfort. While dietary shifts or gas could be at play, persistent pain warrants medical attention. It might hint at bowel cancer. Moving along to symptom number 4, persistent fatigue. Not your run-of-the-mill tiredness, but a lingering exhaustion lasting weeks or months. Colon cancer could be sapping your energy through hidden anemia or nutrient depletion. Don't brush off fatigue, it could be your body's plea for help. Next up, symptom number 3, bloating. A swollen abdomen might signal a partial bowel blockage or gas buildup due to a tumor's obstruction. While bloating can stem from various causes, persistent or unusual bloating merits a doctor's visit. Now, symptom number 2, unexplained weight loss. Shedding pounds without diet changes or increased activity could be a red flag. Colon cancer might be tinkering with your body's nutrient absorption or releasing substances that suppress appetite. Don't overlook significant weight loss, it could be your body's way of sounding the alarm. Lastly, our crucial symptom, the feeling of incomplete bowel emptying, known as tenesmus. Don't forget to hit that like button and share this vital information. Now back to the topic at hand. Tenesmus can be a sign of bowel cancer, as tumors can obstruct the bowel, creating a sensation of incomplete evacuation. Thin ribbon-like stools may accompany this sensation, indicating the tumor's presence. It's worth noting that many folks with colon cancer don't experience symptoms early on. While symptom-free days are reassuring, understanding your risk factors and considering colorectal cancer screening is paramount. Speaking of screening, let's talk about colorectal polyps, the precursors to colorectal cancer. These abnormal growths on the colon's lining can mutate over time, potentially evolving into cancer. Most polyps remain harmless, but regular screening can catch and remove those with malignant potential, averting cancer's grasp. Remember, early detection is key in the fight against colorectal cancer. Let's delve into the factors contributing to bowel cancer and why its incidence is rising among younger individuals. First up, age plays a significant role. As we age, our body's defenses weaken, paving the way for potential cancerous growths, particularly from dormant polyps. Additionally, inflammatory bowel diseases like Crohn's disease or colitis escalate the risk, with approximately 1 in 5 patients facing the possibility of colorectal cancer. Genetic syndromes also heighten susceptibility, such as Lynch syndrome or familial adenomatous polyposis. If you have a family history of colorectal cancer, especially among immediate relatives, it's a cause for concern. Surprisingly, even height factors in. The taller you are, the higher your risk of colon cancer. Now let's address the risk factors within your control. Smoking and alcohol consumption aren't just detrimental to your lungs or liver, they significantly increase the risk of colorectal cancer. A sedentary lifestyle exacerbates matters, emphasizing the importance of regular exercise. Moreover, diets lacking in fruits, vegetables, and fiber, coupled with excessive consumption of processed and red meats, amplify the risk. So, why the surge in colon cancer among younger demographics? It boils down to poor dietary choices, sedentary lifestyles, and rising obesity rates. These lifestyle factors are contributing to the troubling trend. Now on to protective measures against colon cancer. Firstly, ensure adequate hydration and steer clear of constipation to minimize bowel exposure to toxins. Secondly, prioritize a diet rich in fruits, vegetables, and fiber while moderating red meat intake and avoiding processed meats. Thirdly, incorporate natural anti-inflammatories like turmeric and cinnamon into your meals. Fourthly, contrary to popular belief, dairy products, particularly yogurt, cottage cheese, and cheese, have shown protective effects against colon cancer. Fifthly, maintain an active lifestyle to regulate bodily functions and reduce inflammation. Sixthly, abstain from smoking and limit alcohol consumption. Lastly, and most importantly, undergo regular screenings. For individuals age 45 and older, a colonoscopy is recommended, especially if you're at intermediate risk due to family history or genetic predisposition. A colonoscopy involves cleaning the bowel thoroughly before the procedure. You'll be sedated during the test, which typically lasts between 30 to 60 minutes. If polyps are detected, they can be removed during the procedure, potentially preventing the development of cancer. Remember, early detection through screenings significantly improves treatment outcomes. So, prioritize your bowel health, and don't hesitate to take proactive measures. Share this vital information to spread awareness and empower others to safeguard their health. Thank you for watching, stay healthy, and I'll see you